you've been trying the sports, but you're not doing as good as you wish you could. And I just feel that the best way we as humans can enjoy our life and have a better mental break is by doing what you love to do. It's by using your gifts.
It is time for another mental health break. And for this week, I'm bringing on another TGH rock star. I'm honored to keep including all of these amazing Tampa General advocates and professionals to the show. And for today, we're bringing on Kike, who has done a lot of work with us, right? She's got a position at TGH that helps facilitate all the amazing work that I'm humbled to be a part of. So Kike, welcome to a mental health break.
Hi, good morning. I'm happy to be here.
I'm happy for you to join me and everyone for tuning in. Welcome back to a mental health break. My name is Vincent A. Lanci. I'm wearing my TGH gear today in support of the
Yeah.
interview. And I want to ask you to please subscribe to stay current with all of our amazing interviews. And please share today's episode with someone that you feel would find value in it. Remember, you are never alone on this journey. We're brought to you today by comingalivepodcastproduction.com. And Kike, I'd love to have the audience get to know you like I do. Please share your story and what led you to work in the health space.
As I said, thank you so much for having me on your show. This is my first, so I hope I do well.
Ooh.
Yeah, so TGH, why TGH? One, I and my husband actually moved down to the United States a couple of years ago, and I've always wanted to work in a healthcare facility. When I was in university, I actually wanted to study microbiology, and then along the line, switched because I really love IT. So I kind of switched towards that. But my first love has always been having to work in a healthcare facility. So when we moved down to the States, that was my like end game. Nothing spectacular. I just love helping people. I love not just helping people, but being like a first-hand helping hand to people. And that was my first attraction for TGH. I just heard so much about TGH. I had my babies there, and I'm like, okay, one day I would like to work here. And when an opening came, started working with TGH. It's gonna be 9 years in March.
Ooh.
Yes, I started at the bottom. I started from being a patient transporter, and then I moved up to being a coordinator and used it as a unit coordinator. And then I became a department assistant, and now I'm an administrative assistant. Now, bear in mind, these are different roles for different departments. So I kind of have touched base in most of the departments with TGH. That's what brought me here, and I'm enjoying it.
I love it. Well, congratulations on your growth within the company. Of course, TGH is something I always advocate for, right? Not only
Yep,
for bringing me back to life, but they were kind enough to invite me to the state capitol in Tallahassee a few times, which is a lot of
absolutely.
fun. But you
Yeah.
mentioned a few good things there. You talked about you moved and you had babies. So let's start with maybe with some mental health tips for you. You made this big move. How were you
Hmm.
able to stay mentally healthy and afloat?
That's a beautiful question. Moving was a very big deal for I and my husband because we literally just got married, and then we just literally, this was the plan, was to kids a different opportunity. Once we got married, we are like, you know what? Let's just move down to the States. It was a very big decision because we were leaving family behind. We moved from Nigeria to the United States, and it wasn't easy initially. I would say it's still not easy being here without family, friends, and all. Although we've kind of started building our own little life here and making friends and making families here, but it's different from the people you actually grew up with and everything. It hasn't been easy, but I would say one thing, it's been worth it. It's been worth the while. We kind of have learned to believe and trust in each other. And my husband, we built a very strong bond because looking left and right, it's just both of us and our little kids. It hasn't been easy. Maybe probably spending much more on childcare and everything, but it's been worth the while. I would say that.
I love that. And I want to pivot now to you talking about you had your babies at TGH, right? Do you have any
Yes.
advice for new moms? I know I have had guests on this show who talk about some of the challenges after pregnancy that they were unaware of before
Mhm.
they got pregnant. If you wouldn't mind sharing from your experience.
So I had my last baby with TGH, and it was a very hard one for me because aside from it being during COVID, I was walking, I was really sick. In fact, I literally was rushed into emergency and I had to have my baby there and then. And one of the reasons why I would always say this, I don't have any other place to go to. TGH has always been there for me. Had very strong support system from my co-workers, my bosses. They all stood by, they all rallied around me throughout my pregnancy. They saw that I wasn't strong, but they were there. TGH was there throughout, and it wasn't easy, but having a very strong support system goes a very long way. And that's what I found with TGH. My husband literally couldn't come in. He couldn't stay with me because, of course, it was during COVID. But guess what? TGH was there. My TGH was there. Everyone. It didn't feel like I was alone. It just felt like everyone I needed at that time were there to support me. So my case was kind of different, and I was able to pull through because of the strong support system aside from my husband, my family back at home, everybody calling. I had people even within the system having to come in to check on me, having to buy food for me, having to make sure I was okay, having to have the best first world class treatment.
I absolutely love that. And thank you so much for sharing. Everyone, you're not alone. I know there's difficult times, but that's why one of the many reasons this podcast exists, so everyone can connect on shared experience. I love that. So now, how old are your kids?
So I have a 12-year-old. She's always telling me I'm a preteen. She's going to be 13 this year. I have a 9-year-old who is going to be 10 next month. And I have a 4-year-old who is going to be 5 in March.
Congratulations on being an
Thank
awesome
you.
mom. And we've talked a little bit about your work. We learned a little bit about you. Now, I'd love to ask, when you're not at work, what are some of your favorite things to do? Because I'm a big advocate in a mental health day where unfortunately sometimes it's a half day if there's a lot of work, but it's something
Mhm.
where I make sure I spend time doing something I love.
When I'm not working, my hands are really full. As you heard earlier, I have 3 kids, 12, 10, and 4. I have my hands really full, but I still find time to have my me time. And I get to have that at least for an hour every day. I walk and I bike. That time I just use to like think over the day to see how my day went, what I'm meant to touch base on. I'm walking, but I'm also thinking about me, where I can be better, what I can do to be better, but in my own space. The kids are not there. I'm not thinking about work. My husband is not there. Sometimes we work together, but most times I like just taking a walk by myself, and then probably when he gets back from work later, we bike together, and then that's my me time. Aside that, my kids are there, so they kind of feel the remaining part of my days. Whatever activities they want to do, we do with them. We also take them on bike rides around our community, and basically, yeah, and I love watching movies a lot. So if I'm not doing any of that, probably I'm watching a movie or I'm cooking.
Well, a lot of great things you said there, and I loved how you highlighted walking. A big
Yeah,
misconception is that when people promote exercise, it equates to lifting weights and all, which is, but I'm a big walk taker as well. Every day I take walks, it
absolutely.
clears my head and it just gets my body moving. And I
Absolutely.
find I'll tend to overthink and not be as productive if I don't find some form of exercise. And of course, everyone,
Absolutely.
what works for some doesn't work for everyone, but I can promise you that getting in the summertime, or if you're in Florida, the sunlight hitting
Mm-hmm.
your face and the
Mm-hmm.
natural mood elevators, it's a beautiful thing. Shifting some other fun stuff here in 2026, we're airing this here at the top of the year. What are some things you're looking forward to throughout the year?
I really have learned not to jinx my year because I'm that one person that I used to plan my year and it doesn't kind of fall the way I plan it. I'm kind of going with the vibe this year. I'm going with what life kind of shoots at me. What I'm able to control, I'll definitely control. And what I'm not able to, you know what? It is what it is. I recently lost a very dear friend that has kind of set me aback. And I just want to live in the moment because you never really can tell. This year, the truth is, I just want to live in the moment. I don't want to make any plans. If I had any plan initially, right now at this point, I really want to live in the moment.
I love that. And you talked a lot about focusing on you and everyone. You can't be a best friend to anyone else until you're a best friend to yourself and you do the things you need.
Absolutely.
I'm very sorry for your loss. And death is a very interesting and weird thing. And
I know.
what have you been doing to cope, if you don't mind, to help other people out there who may have also lost someone recently? What are some things that worked for you?
Truthfully, initially I bottled it in, but I've cried. I kind of got to a point where I had to cry. I didn't mention this, but the person I lost was very dear to me, and I have never lost anyone close to me. This is the first time in my whole years that I have lost someone that I really know and someone that is really close to me. She's back home. That thought, like, okay, probably she's at home. Let me just forget it. But it got to a point where I found out that it started affecting me, it started jinxing some things. I'm like, okay, I need to cry. I need to cry. And I didn't cry to anyone, actually. I cried by myself. I just went through the whole phase by myself. I didn't want to be told how to feel, how to mourn. I just, and literally, I was telling my younger sister, it's okay to cry. You might be scared that you might think about her, but I felt more relief after crying and just mourning her in that way. I don't know if that sounds right, but I kind of feel better because that pain, part of that pain, I let it out. It's just literally a week. I've cried and I've felt a little bit.
Life, we're going to have adversity constantly thrown our
Mhm.
way. So I hope this recording is a nice little break from reality and we get to just relax and again talk about all the great work you do at TGH. And we've highlighted
Absolutely.
your journey in TGH. What is
Mhm.
one of your favorite parts about your new role?
It's a different one, literally a different one. And I get to touch base on departments and units of TGH because aside from working with Amber for PIFA, we do the language services. And when it comes to language services, we touch base on all the departments. So it's been fun. Aside from it being a new role, it's like a new journey entirely and very interesting one. You get gotten to know different multiple languages that I never knew existed. So yeah, it's been really fun. Yeah.
That's awesome. You get to learn. I mean, I tried learning Spanish, or I did learn Spanish a few years ago. I came out with a kids book called Going to School, where I wanted to introduce kids to
Oh,
basic English and Spanish as they grow. And I tell you, I took Italian growing up, and I feel like I was able to grasp and retain that when my brain was still younger and a sponge, where
yeah.
now it
Uh-huh.
it was a language that made no sense to me, especially in comparison to English. So it was just a
Yep.
whole whirlwind. So I commend you on that. And I also
Hmm.
love to be a lifelong learner. If college were free, I'd probably be there
I know,
forever. But
right?
right, we're still paying the price with those college loans. But that's not
I
what this
know,
show
right?
is about. Mental health break here. Everyone, remember you're not alone. I hope you're enjoying the episode, and we're still got a little bit left. So I'd love to ask
Yeah.
Kiki if you could give a piece of advice to anyone out here listening on today who may be struggling, what can you offer them?
Do what you know how to do best. Do what you love to do. It kind of reduces whatever mental issues you might have. I, for one, I was speaking with my 12-year-old daughter recently. We've been trying you with, she's been wanting to do sports, 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 but you're not doing well in it. I don't think, why don't we shift doing something that we know that you're good at, your gift? Use your gift. I think it will make more room for you. And she really started it in the beginning of this school year, and she's been doing awesomely well. So she moved from doing the sports to music. She has a beautiful voice. I'm like, you have a beautiful voice. Why don't you just use it? You never know. You've been trying the sports, but you're not doing as good as you wish you could. And I just feel that the best way we as humans can enjoy our life and have a better mental break is by doing what you love to do. It's by using your gifts. It's very important because whether which way it's in there, if you don't use it, you keep suppressing it, but then you would never be fulfilled until you start using it, until you start tapping at it. So my advice to people out there is try and tap into that gift which is within you, and I'm sure it will make rooms for you.
What a beautiful last word there,
Yeah.
Kiki. Thank you so much for that. Thank you for being open to share your story. And thank you so much. Of course, thanks for joining us here on a mental health break. Everyone, please remember to subscribe so you don't
Yeah.
miss amazing shows like this. Please share the episode with someone who
Hmm.
could find value to take a deep breath. But I'd love to ask, Kiki, where can
Yeah.
we find you? Where can we say hello?
I really don't do much of the social media thing. Yeah, so you can only find me at TGH, Patients Experience.
Everyone, TGH, it's an amazing
Amazing.
organization. They have
Very
amazing
amazing.
leaders. As I mentioned, I've been honored to feature a bunch on this show. You heard
Hmm.
Kristen last week. Amber was on a little while ago, and I'd love to
Hmm.
keep bringing them back because of the value they do, not just for the health world, for the mental health world. My name is
Hmm.
Vincent A. Lanci, and today we are brought to you by ComingAlivePodcastProduction.com. To start your podcasting journey today, head to the website to get your free podcast launch checklist. And with that, we're signing off with a very special episode based in Tampa, Florida. Kiki, thank you so much for giving me your first interview. You did a great job.
Thank you so much. I appreciate you having me.
Thank you for tuning in to another episode. I would love to hear your feedback. What did you love? What do you want to see more of? Are there any questions you would like me to ask the guests who come on the show? This show is not possible without you, the amazing listeners, so please email us at podcastsbylancy@gmail.com and let us know what you think. We'll also feature you on a later show. Please remember to subscribe to stay current with our amazing community of guests who will continue to come on the show, sprinkled in with solo episodes from me, Vincent A. Lanci. With that, I look forward to introducing more shows to you each and every week. And with that, we're signing off today. Enjoy the episodes and make it a great day ahead.